Thanks a lot, Devendra, for that introduction. At the outset, I'd like to thank yourself and Dr. Rashmin sir for allowing me the opportunity to be a part of such an esteemed panel. So going further with that lovely introduction, my topic today is FRC oft and my experience in a nutshell, or how to approach the exam. Uh, I would really thank Akshay and Devendra again, because they have covered a lot of this, the stuff required for this examination as well. So some of these slides and some of the sources might be repeated. Coming to the college, the Royal College of Ophthalmologists, as Devendra had mentioned in his talk, founded in April 1988, supposed to be the voice of the profession in the UK. How does it help in terms of your career progression? It is considered to be an exit level examination. It is one of the necessary requirements to be a consultant in the UK. In brackets, I've written incomplete because it is not the only thing that is necessary. There are other things that need to be completed, like hands-on experience, clinical cases, and a lot of surgical experience as well. Now, recently, it provides exemption from PLAB, so you can directly register with the GMC with the FRC of the exam. And there's been a very recent update. In fact, Devendra was kind enough to share that with me yesterday. Start from 2020 to this exam can exclusively be given in India. There are a few parts that you could give previously in India, and a few where you had to travel to UK, like I did on a couple of occasions. But now they are planning to get the whole examination done exclusively in India. The exam, as with any fellowship exam, is divided into parts. Part 1, followed by refraction certificate, and part 2, which has now been decoupled into written and oral parts. Part 1 fellowship, you don't need any experience in ophthalmology to apply for the examination. This examination is based on the learning outcomes of the first 2 years of OST. OST is the curriculum which is known as Ophthalmic Specialist Curriculum, training curriculum in the UK, which is being charted and diligently followed and updated on a year-to-year basis with new inputs from existing consultants and educational supervisors. The exam generally has 3 sittings per year, but these things change often, more so often since the pandemic. Things have been changing a bit more rapidly. Maximum allowed is 6 attempts for the examination. The format, it's a 2 into 2 hour MCQ paper of 90 questions each, so 180 questions in total, consisting of 1 single best answer out of 4 options. From October 2020, it is now an online proctored exam, so you can take it at home and workplace. Of course, this might change in the near future as countries and situations come out of lockdown. So this exam can now be delivered over internet to the candidate's computer at the pre-agreed date and time, and there is 1 hour break in between 2 papers. Just to give an example of what is expected with the level of simplicity or difficulty, the way you take it, I'll read out the question for you in regards to optic nerve. Which statement is most likely to be correct? The option A, if it is completely myelinated at the time of full-term birth. B option is ensheathed by perineurium, epineurium, and endoneurium. Option C is Schwann cells within the optic nerve responsible for maintaining myelination, and option D is the subarachnoid space is much narrower in the intracanalicular part than the orbital part. The correct answer is, of course, D. Preparation, as you can see, there is an overlap. So any basic science examination, the resources are very, very similar. There is one particular book for basic sciences in ophthalmology specific for FRC oft. It is followed quite closely by trainees over here, but I've gone through that in detail. It was not there when I gave the exam. It is not very different from the other sources. So you can opt as an option, follow it or stick to the other basic sciences books. Textbook, as Devendra mentioned previously, Forrest is a very good source. It is like a guidebook. There's a lot of information in that small space of the pages of books. So you've got to have at least more than 1 reading to fully comprehend it. And standard clinical optics by Elkington should be more than enough. After you pass the part 1, next bit is the refraction certificate. Again, no previous experience in ophthalmology is necessary for you to apply. Generally 3 to 4 sittings per year, maximum allowed 6 attempts. Now, there is no need for you to give part 1 first and then refraction certificate. You can give refraction certificate first, followed by part 1. So there is no eligibility criteria with respect to these two parts as an overlap. Now, the format of the refraction certificate is an OSCE-based or a structural clinical examination based with 10 stations. Since December 2020, following the pandemic, it is now fully electronic. So there are no patients. There's no paper. You have to do your retinoscopies and enter them into an iPad. And these retinoscopies are basically simulated. So they have a high-knee retinoscope trainers with hidden trial lenses. And earlier, the exam used to consist of 12 stations. They've reduced it down to 10 stations now. This is an example of an OSCE sitting. So as you can see, out of 10 stations, 9 stations are simulated retinoscopy stations for the high-knee retinoscope. So you need to be very well versed with the retinoscopies. After the refraction certificate comes the part 2 fellowship examination. You have to pass part 1 and the refraction certificate to be eligible to sit for this. The part 2 examination, written and oral, it combines a form of synoptic exit examination. They use several techniques to assess your knowledge. So they are expected, candidates are expected to demonstrate your knowledge with the depth and understanding that is expected to be of an independent new consultant in the field of ophthalmology. Trainees in the UK should pass the written and oral examination before year 7. Training in the UK consists of 7 years. It has been decoupled recently, which in other words means that a few years back, you had to give the written examination and pass the oral examination immediately following the written examination. If you do not pass the oral, you have to go back and write the written. They have decoupled it now. So once you pass the written, you don't need to give that again. There are maximum of 4 attempts for each, the written and the oral examination. With respect to the written examinations held twice a year, of course, these things change. This can, again, like a proctored examination, be taken at home quite recently. It consists of 2 papers, MCQ-based, 90 MCQs each, single best answer from 4 options. 2 hours each paper and an hour's break in between. Again, this is based on the ophthalmic specialty training curriculum. This is a blueprint of the division or the subcategorization of the 180 MCQs that you can expect. It is followed to the number in most of these examinations. So as you can see, clinical ophthalmology is divided into retina, cataract, and other subspecialties, for example, but there is also some emphasis on pharmacology, 12 MCQs, investigations, and on statistics, epidemiology. So basically, it's a holistic approach. You have to know bits and pieces of everything to get through this exam. An example just given here about the important thing regarding this question is at the bottom of the question, where according to the NICE guidelines, so it is just an example to show that you need to be well versed with local guidelines followed in the UK with the NICE and the Royal College of Ophthalmology. Another example again, just to explain the level of difficulty expected in terms of reading needed to answer questions. Going again through the International Vitreomacular Traction Study Classification System. So just to elicit that you need to be well versed with the various classification systems and have your knowledge quite up to date. Resources, yeah, again, overlap with Kansky. Oxford Handbook on Ophthalmology is quite diligently followed in this country. And a lot of questions are picked up from that book. I particularly like the Moorfields Manual of Ophthalmology. It is a very, very practical book which gives a lot of insight into day-to-day practice, and a lot of questions can be picked up from a Moorfields Manual as well, because obviously those are the examiners who set the exam papers. Resources, there are dedicated books written for Part 5 FRC, which you can look over at Amazon, and with each passing year, people who pass exams keep on adding new textbooks. The age-old website of CHUA which is the MRC of, is a very, very useful resource for this exam. There are other online MCQ resources like idocs.co.uk and Off the Questions. Off the Questions have a specific bit for the FRC of examination. I myself used Off the Questions and found it very useful. Emphasis on the Royal College of Ophthalmologists clinical guidelines. You get questions asked left, right, and center, not only in the written part, but also in the oral examination, because those are the guidelines which are followed in the UK. NICE guidelines and ophthalmic service guidance. All these things are given in detail on the Royal College website. So, and they are free to download. Important also is the DVLA, which tests the vision requirements for driving, and you're tested and asked questions not only in the written but also in the oral examination. And a brief idea about the General Medical Council Good Medical Practice Guidelines. After the Part 2 written comes the Part 2 fellowship oral. You are eligible after passing the Part 2 written. It's held twice in a year in the UK and once in Singapore. Now, with the recent changes, I've just come across information that it is going to be held once next year in India and probably twice a year after that, every year in India. Max 4 attempts. Once you pass the Part 2 written, you can give the oral examination within the next 7 years for a maximum number of 4 attempts. The structure of Part 2 examination, as any oral examination, is divided into structured viva, which generally happens on the Monday and Tuesday of the week. Then OSCE, which is a structured clinical examination on the rest of the days of the weekdays. So the structured viva has 5 stations, each station of 10 minutes, which are basically CBDs or case-based discussions. So you will be given a biometry printout or a HES chart or an electrophysiology printout for examination, for example, and there will be a few questions that the examiner will ask you. These questions are preset with a sequence and they have been marked accordingly. Second station is basically acute ophthalmic emergencies, which they will not be able to test you in a practical face-to-face situation. So they will ask you questions based on that with station 2 and station 3. Station 4, attitude, ethics, and responsibilities. So if you look at the list of topics, they'll ask you questions related to suspected child abuse, medical ethics, consent, confidentiality, duties of a doctor, appraisal. All these things are given in detail on the GMC website. So you need to have a good read of that before going for the practical viva examination. Station 5 is audit research and evidence-based medicine, basically evidence guidelines with the college and the NICE guidelines as well, and also related to driving again. Now, I've said 5 stations, but there's a number station 6 here, which is a communication skills station, which is picked up from the OSCE part, where we have actors who will interact in between the candidate and the patient and may include like history taking for ptosis, history taking for cataract, taking consent for surgery, explaining the risks and benefits, or some form of counseling or advising patients, or dealing with an angry patient's relative for examination. For station 1 to 5, traditionally there is one examiner. For station 6, that's a communication skill, you will have 2 examiners. One is a consultant ophthalmologist and one is a lay examiner or a non-ophthalmic examiner. After the viva comes the OSCE. It's a breeze through 5 stations, 20 minutes each, 2 examiners and 3 patients or 3 cases per station. Now this has changed because of COVID, obviously. These are now videos only. So station 5 is the anterior segment, station 2 is glaucoma and lid, then followed by posterior segment, strabismus and orbit, neuro-ophthalmology, and station 6, which is the communication skills, which you've already done in viva part. So this is basically a 5 station, 20 minute each. Just give you an example of the video. This video has been picked up from the college website. So just to emphasize what they would expect. So they will start a video like this. The examiner won't say anything. You'll have to look at it carefully. And as you go, you can, as a candidate, start describing what you see. That will help the examiners to know whether you're going the right direction. They can obviously give you a hint if they think that you're not going the right direction to get you back on track and ask you questions pertaining. Again, these questions in terms of the patients and in terms of these videos are pre-decided. So there is a sequence of these questions with answers. So all this is done to minimize the human factor with the examiner. So it's a very fair way of assessing. Let's go ahead. In terms of a new temporary COVID requirement, because this OSCE examination is a video examination only, and as I previously mentioned, that they want to see whether you're good enough to practice as an individual consultant. They want to know if your clinical skills are up to date. So what the college has advised is your clinical skills will be assessed beforehand in a clinical setting by a college appointed examiner who will test you for 7 clinical competencies. And this needs to be done at your local hospital at least 2 weeks before the examination. You can have 3 attempts at this clinical assessment, and they will examine you for all these things. So they'll probably tell you to pick up a nurse from the clinic, or another colleague can tell you to demonstrate all these things in detail, and they'll mark you for that. How to go about, again, with Viva clinical scenarios with OSCE, as mentioned previously, practice, and a lot of practice, especially practice the subspecialty clinic patients, for example, strabismus, orbit, neuro-ophthalmology. Those are the challenging ones because we don't see them day in and day out unless you have a dedicated department and a specialist who deals with patients like that. Again, I am re-emphasizing this, but it is very important that you go through, after reading your Kansky and after reading your Oxford Handbook and your Moorfields Manual, to read the NICE guidelines, read the college guidelines, read these GMC documents at least. There is a very comprehensive, good medical practice document. It's given a lot in detail, but it's like a novel. If you can just sit on one afternoon and read it, you'll get a fair idea of what they expect out of you. DVLA, which is the driving vehicle licensing agency in the UK, recent study papers, and in some instances, you may the candidate is given an advance notification asking them to read a particular paper for discussion at a forthcoming examination. Also remember, this is an exit level examination. So in terms of your knowledge and demeanor, a high level of both is expected. You can't show startled expressions to the examiner as if you have been bowled out, or don't show hyperexcitability, because they are trying to see if you are seeing a patient in a real world where you see a finding and either you get excited or you're trying to figure out what it is in terms of trying to memorize differentials in your mind. As I mentioned, they even mark you for facial expressions and your posture and the way you speak. So this is not, the last point is not practicable at the moment, but I'm hoping very soon they'll have face-to-face examinations where you would then need to remember to switch the slit lamp off before you answer any questions, because they will mark you against it. Again, a common mantra: prepare early, score well. The best way to pass is treat each and every patient which you see in your clinic as an exam case. Inculcate the good ophthalmic and medical care in day-to-day practice with skill examination, high level of knowledge, and safety. Good luck. If you have any questions, I'm happy to answer them over phone or on email. This is a UK number, so you can maybe even WhatsApp me on that, and I'm happy to answer. Thank you.